Unfortunately, enrolling in Medicare is not as easy as turning 65 and telling the US government, hey, I'd like to enroll in Medicare now. And there's a really important gotcha that I want to make sure the viewers of my channel know about, because it can be really painful if you miss it. Okay, so let's jump in and go for a walk and talk about it. So Medicare is really broken down into two parts. There's the traditional Medicare, which is run by the federal government. And then there's what's called the Medicare Advantage Plan, which is run by private companies and is more of a managed care type plan. And every year you have a choice between the two programs. But stay with me, because there's a gotcha here. So let me tell you what's involved in the traditional plan first, and then we'll talk about what's involved in the Medicare Advantage Plan, which is the one run by private companies, and where that gotcha might be. Okay, the traditional plan, any hospital, any doctor that accepts Medicare, you can choose your doctor, you can choose your hospital, and it's a lot of choices. There's a lot of doctors in the program. And it's not managed care. You and your doctor choose the treatment, choose the course of action that's best for you as the patient. And so that's the advantage. You have a lot of choice, right? You can work with a lot of different physicians. You and your physician work together in partnership, trying to figure out what the best course of action is for anything that comes up that you might need medical care for. But the negative of that is the traditional Medicare, in general, pays about 80% of the cost, and there's a 20% deductible. And so a lot of people buy what's called a Medigap or a Medicare supplement. And the gotcha involves that, so stay tuned. But first I want to tell you what the Medicare Advantage Plan is, the one that's run by private companies. And because it's run by private companies, every year towards the fall, when it's open enrollment and people can switch between those two plans, you'll see some advertisements on television for it, right? Because the private companies are using commercials to try to get more customers for their service. In the Medicare Advantage Plan, you might also hear it called Part C. And this is more like an HMO or a PPO plan, right? It's an alternative way to receive your Medicare benefits. It's not run by the government. It's run by private insurers that offer it. And there's usually either a low monthly premium for it or oftentimes $0 monthly premium. And it might include other benefits that traditional Medicare does not offer. It might include vision or dental or hearing services. And that's designed to encourage people to join the Medicare Advantage Plan, because again, it's run by a private company and they're hoping to make a profit from it. One of the disadvantages of the managed plan is the list of physicians, the list of hospitals that you can go to is nowhere near as extensive as the traditional Medicare. And there still are co-payments and co-insurance, and that's going to depend on what the plan is and who the provider is. And so that's kind of what the two programs are. But here's the gotcha. While you can switch between the Medicare Advantage Plan, what I call Part C, and the federally run program, traditional Medicare, for that 20% deductible on the traditional government run program, most people want to sign up for a supplement called Medigap to help them with that 20%. And the gotcha is you have a 6-month window where you can qualify medically, where there are no pre-existing conditions. There is no medical exam that's required to get the Medigap. So when you first join Medicare, you have a 6-month window to do that without any what's called a medical insurance underwriting. And that can be a powerful thing, right? Because if you have a heart attack or you have cancer, you can find yourself being denied for that coverage later on, where at first you have this window that you don't have to go through the medical underwriting insurance part of it. So I want to share with you a story, and that is regular viewers of my channel know that unfortunately the men on my side of the family have heart conditions. Specifically, we build up cholesterol, and that causes problems and can cause heart attacks. My father had his first stroke when he was younger than me. He had his first heart attack when he was about actually a little bit younger than me now. So, and fortunately he survived all those, and he made it to 80. Now, I grew up outside of Cleveland, Ohio, and one of the best heart hospitals in the world really is a place called the Cleveland Clinic. And so my father was on one of these medical advantage plans that was done through private insurers. And my father would say that decision saved his life, that he would not have been able to afford to go to the Cleveland Clinic if he had to do the 20% copay. So these are really important decisions. My dad would say it added at least 10 years to his life, right? But there's also downsides to it. You know, as you become a bigger consumer of healthcare services, many people would say, you know, I want the federally run program, the traditional Medicare, and I want to have the Medigap insurance on top of that. But just know that there's a window. Also know that I am not an insurance broker. I am not an insurance expert. And this is not Medicare or insurance advice at all. This is really designed to raise a flag and to raise your awareness that this issue might be out there, and you should talk to, in my opinion, a professional to help you choose the plan that's right for you, because you might not be able to go back, right? Depending on whether you can pass the medical underwriting that companies are allowed to put you through to approve you onto a Medigap plan. So, you know, most people don't know about this. And so if you don't know about it, I want to put it on your radar screen, and I want to encourage you to work with a professional that is a licensed insurance agent to help you make the decision that's right for you and your family. So there's that initial window, and then there's also something that's called the trial period, where it's not just 6 months from when you turn 65, but there's another loophole that you might qualify for, but you want to know if you qualify for it. So again, I am not a licensed insurance broker. I don't want to be a licensed insurance broker, but I want you to be able to make the best decision for you and your family. So I wanted to put this on your radar screen. I hope it was helpful. If it was, I know you're going to enjoy this video up here that talks about average income for retirees, and this video down here that talks about 5 reasons to think about retiring as soon as you can. Thanks for watching. Bye-bye.